Mr. and Mrs. Jones. How are you doing today?
Hi, Dr. Pridgen. How are you?
I checked your hearing aids and it seems that they're working properly, but I was wondering how satisfied you are with your hearing.
I do have issues hearing and background noise.
Okay.
When I go out to a restaurant with my family or friends, and the noisy restaurant definitely affects it. I have issues at work and church, definitely in loud, noisy environments.
Okay.
She can't hear a word I say when I talk to her when she's in another room.
I understand. Many of my patients have the same complaints. Even with your hearing aid, you're only accessing 75% of the speech spectrum. So, looking at this right here is roughly what you're accessing, and this part right here is what you're missing.
Oh, wow.
So, if you'd be interested, I do have this short questionnaire that you can fill out. That way I can better understand what you're going through and what you're missing out on.
Okay.
And when you're done, if you could just give that back to me.
There you go.
All right. It looks good. I'm glad you're not experiencing any pain. Okay, so from what I'm seeing, I really believe that you would benefit from something called auditory training.
So, what's auditory training?
Auditory training helps further develop speech recognition, maximize your residual hearing, which is what you already have, and help with sound distinctions. So if you would be interested, I can refer you to a speech pathologist who will help you with your auditory training. She's a good friend of mine, and I think you would really benefit from this.
I am definitely interested in that.
Okay, awesome.
Thank you.
Hi, Mr. and Mrs. Jones.
Hi, how are you
It is
doing?
so nice to
Nice
meet
to
you.
meet you.
Nice to meet you.
All right, I am Miss Sibbett, and I'll be your speech pathologist. So I'm going to take her, and I'll be back to talk with you in a minute, okay?
Bye.
All right, bye.
Bye.
Okay, Mrs. Jones. So I've reviewed your questionnaire that you did at the audiologist last week, and
Okay.
so I've seen that basically your biggest problems are with speech, with nervous background noise, and speaking with the telephone. Is that correct?
Yes.
All right. Is there anything else, any other concerns that you have that you didn't list?
I don't think so, no.
All right, so let's talk a little bit about auditory training.
Okay.
So for many individuals with hearing loss, communication challenges are not fully resolved with the addition of one or more hearing aids. So just because you have a hearing aid, that doesn't mean all of your hearing challenges have gone away, as you very well know.
Yes.
So basically what we need to do is some auditory training. This will help to maximize your use of available speech information. And it can be done through online programs or through face-to-face sessions. Now, there are benefits to both. Online programs, you can go at your own pace and you do whenever you want. However, in a clinical setting, which is where we are right now, you do have someone to guide you, to have the activities ready for you, and you don't have to worry about the burdens of technology.
I'm not good at technology.
Yeah, it's hard.
Yeah.
It really is. I'm not very great at it myself. So, all right, so I'd like to start with some activities. So
Okay.
this first activity, we're going to do with some background noise, and I know that's one of your main concerns. So I'm just going to play some background noises, and I'm just going to say one of these sounds, and I just want you to point to which sound that I said.
Okay.
Okay? Buh. Very good. That's exactly right. The.
Could you repeat it?
The. That's right. Excellent. Okay. Shh. Very good. Puh. No. Try again. Puh.
I think that one.
Yes, that's exactly right. All right, and the.
Can you repeat it?
The. Excellent work. All right, so that was just hearing individual sounds with background noise. That will help you be able to distinguish sounds when you're hearing people speak. So now I have some words. It's just going to step up a little bit. And I'm not going to use the background noise. I'm just going to cover my mouth so that you can't see my lips moving. And I'm going to give you 2 words, and I want you to say the word, or point to the word that I have said.
Okay.
Okay. More. Excellent work. wow, I think this might be a little bit too easy.
Maybe.
So I'm going to add in the background noise again.
Okay.
And so this will really help us with our main concern. So
Okay.
here are the next two. Shook. Great job. You are really getting this. Chair. That one. That's exactly right. Okay, you did so well on this activity. Let me
Great.
stop the background noise.
Okay.
So for this next activity, we are going to go through it once with the two of us, and then I'm going to go talk to your husband for a few minutes, okay? And then I want you to keep doing the activity. So this one is on my computer. So basically, it is a person speaking to you. There will be some background noise, and I need you to type in the rest of the sentence, the blanks that are missing.
Okay.
So I'll type this one in for you. I just want you to really concentrate on hearing what he's saying.
Okay.
If you must choose between two evils, choose the one that you've never tried before.
So what did he say at the end of that sentence?
Choose the one that you've never tried before.
Excellent work. You were exactly right. Okay, so do you understand this game?
Yes.
Okay, I'm going to go talk to your husband for a few minutes. I'll be right back, okay? You can pause it. Okay, Mr. Jones, I just wanted to take a moment to speak to you. I know Mrs. Jones has been having some trouble communicating in noise, and I'm sure that this is something that affects you as well. So I have a handout that I'll go through with you to help improve communication between you two. So these are what we call the 10 commandments of communicating with someone that has a hearing loss. So they are ones that say, you know, you're not supposed to speak to someone from another room. You're not supposed to turn your back towards the person. You're not supposed to speak and then walk away. Do you have any questions?
So I shouldn't yell at her from the living room to get me something to drink when she's in the kitchen.
No, you know, she'll probably have a hard time hearing you, and it could lead to frustration for both of you. You know, this says that you need to make sure that you're in the same room and that you turn off everything that can compete, everything that has some background noise. And make sure your face is clear and that you're communicating the best you can.
Wait, does that mean my mustache okay? Do I need to take care of that?
As long as you eliminate other distractions, your mustache should be fine.
Kind of attached to it.
Yeah. Do you have any other questions?
Is there any way that I could help her understand me better on the telephone so I don't have to repeat myself a gazillion times?
Oh, sure. You can try to go to a quiet area just to reduce some background noises and have her do the same so that you both have the easiest way to communicate with each other. All right, anything else?
I think that's it.
All right, I'm going to just go talk to her for a second. I'll be right back.
Okay.
Oh, all right, Mrs. Jones, how did that last activity go?
It went good, but I missed two of the sentences.
Well, that was the most challenging activity that we did today. And with practice in the weeks to come, it will become easier. And you did such a great job with your activities today. So next week, we're going to continue with these activities. So I really look forward to seeing you then. You did a great job today.
I look forward to seeing you too. Thank you so much.
Okay, great. Have a great day.
You too.